Let's talk about this more now with one of our regular GPs, Dr. Nigat Arif, who joins us after a couple of weeks off for the Olympics. Lovely to see you again. Can we talk to start with, Nigat, about this campaign to try to get more young people vaccinated? Is the promise of nightclubs and kebabs and what else is there that's on offer? All sorts of free taxi rides. Is that going to work? Can you see that working, persuading them?
The most important message out there has to be that the COVID vaccines are safe and effective and the best way to protect you against COVID-19. Incentives such as, the headlines that were out and about, like kebab for a jab or get pizza rides. And I think that in a way, sometimes incentives can work. The bigger incentive will be if they're able to get on with their daily lives. My sister is a dentist, and actually she was very hesitant about getting her vaccine. She's a dental student. And the only way I could persuade her was obviously go through all the data with her and make sure that it is safe, because her biggest thing was the fact that, is it something that I definitely need? Because if I do get COVID, I'm probably going to be absolutely fine. I will have very few symptoms and not get severely sick. And her other thing was, I don't want the side effects of the vaccine. And also she'd had a lot of Facebook things on social media that were saying the vaccine will cause infertility, it will affect your periods, there's trackers, there's chips. And young people who are plugged into social media, there's no way of getting away from it. That's how they get the information. But I was able to persuade her. And also her university said that parts of her course, she wouldn't be able to interact with patients unless she had the vaccine. So it's mostly going to be, I think, freedoms, what you're able to do, able to go to nightclubs. But we want to get back to some sense of normality. And that's going to be the bigger incentive for young people.
It's interesting, isn't it, what you were saying about your sister and her situation? I mean, since we last spoke before the Olympic break, the government have announced that 17 and 18-year-olds are now going to be eligible and that it could potentially go lower. On the front line, when you're in your surgery and dealing with patients, how much interest is there, do you think, among those younger people, the younger teens, to get a vaccine? Are they even talking about it? Does it register with them?
It does register with them. There's a group of patients that I actually only last week, when on the 4th of August, the JCVI announced that it is going to be eligible to 16 to 17-year-olds. And I had parents contacting us at the surgery going, please, can we have the vaccine? Because we don't want our child off school anymore. We don't want our child's GCSEs and A-level chances to be scuppered, because this is for something for the rest of their life. We cannot get away from the fact that also, if you are severely sick from COVID, you can get long COVID symptoms. And we're seeing that, John, in our surgery. So chronic fatigue, shortness of breath, cough, aches and pains. And that is a huge worry that we have as doctors. And the vaccine will prevent that as well. So there is some interest. What we're saying to people at the minute is there's that whole fire. We are getting through the numbers, and the NHS England will contact you individually and tell you when you're eligible. Again, just as you saw in that video that you played earlier, there is hesitancy. So we're getting also young people going, do I necessarily need this? What side effects am I going to get? And, what is it in it? What's in it for me to get the vaccine? Those questions are still coming around, and we're trying to tackle and answer those questions as much as possible.
It's interesting. You could have a clash the other way around within a family, though, couldn't you? You could have apparently a parent who might be worried about their child getting the jab, but a child who's keen to have it and can go ahead and have it themselves. Are you aware of that kind of dynamic going on as well?
Definitely. And the thing is that 16 and above, if you're what we in medical say, Fraser or GLIC competent, you're allowed to go, and you're considered an adult, you're able to go and make your own choices. You're autonomous enough to go and make the choice regarding the jab. Parents have their own concerns. But my sort of thing to parents is that think about it. We give vaccines for lots of different things. From the time that a baby is about 4 or 5 weeks old, we start the immunisation program. To start childhood immunisation programs actually are through a lot of data, a lot of research. And these vaccines that we're giving at the minute with the COVID vaccine, they're on the back of, years, 100 years of information around vaccine. It's since Edward Jenner, so centuries old of information of we know how vaccines work and exactly how they're able to protect lives. So please don't worry. My son has had a liver transplant. He's 6 years old and he is in the clinically vulnerable group. I have that much faith in the vaccines that when it gets to younger age groups, that the COVID vaccine is offered to children, I would be there first in the queue waiting for my son to have the vaccine, because I know it will protect him. Because at the minute I'm living on tenterhooks, always panicking whether he's going to get COVID-19. And that's not a way to live either.
Well, that's difficult given your job as well, and on the front line, constantly mixing with people. And, we're trying to remember that it's summertime. Hopefully there's some good weather coming. But I guess you and the NHS, you're also thinking about all those other bugs that could be confronting us come the autumn as well. We've had norovirus outbreaks and flu, of course, season just around the corner.
Yeah, so we're already planning for that. We've been busy whilst everybody's enjoying the sunshine. I'm not going to complain, but we have been planning out the flu season. And this year, the uptake is going to be rolled out to even further age groups. And so there is logistics in place. But what primary care does fantastically well is roll out huge programs like this. I mean, it's the biggest historical vaccination program ever in the NHS. And all of us primary care colleagues, from pharmacists to nurses to district nurses to GPs, everybody out in the communities, we've been doing our level best to get the vaccination programme up and rolling. We still have to tackle misinformation, and Team Polio, which I'm part of, we're doing a lot of work around that. We're still trying to engage with harder to reach communities, or communities that aren't engaged with mainstream medicine so much because of language barriers, etc. And the flu vaccine is going to be that other bit of key component, because the last thing we want is to go into lockdown again because we've got a rising number of cases. And flu and COVID symptoms are very difficult to distinguish unless you get a COVID test or PCR test. So this is a really important thing. The lateral flow tests that you have at home are the ones that you should be doing twice a week if you have no symptoms, and also a PCR test if you have symptoms, because the lateral flows can be false negatives as well. And that's really important for people to know, because I know there's been a decrease in uptake of the PCR tests in the summer months as well. But then people are enjoying the summer, and they've enjoyed the Olympics as well. So
yeah, have you enjoyed the Olympics?
Definitely. I've tried to catch it as much as I possibly can. I've mostly been watching Dan in the mornings, and then obviously in the evenings when I come back as well. But it's just been, I think this is what we needed. The nation needed to have our hopes lifted and to come forth in the medal table. I mean, that's just phenomenal. Considering we've done this, all the athletes have done this. I say we because I've never run in my life.
Oh, you do run. I know you run.
Oh gosh, yeah. Forget Louise is listening.
Nigat, thank you so much.
They've done amazingly. Thank you.
It's been great, hasn't it?
Yeah, great to talk to you. And we will be talking about the Olympics throughout the morning.